My name is Jake Audette. I work with a company called DVM Consulting and Recruiting. Our main background is helping small private practices find veterinary doctors, whether that's, vets with a lot of experience in the industry or new grads just coming out of school. We help them all. But helping private practices, mainly small private practice in rural or urban areas, that's our main bread and butter. And that's who we mainly assist with that. Along with, we'll fill a couple support staff positions as well when we're working with a clinic, just as an added bonus if they need that sort of help. A few quick housekeeping things just to get settled. Everybody that's attended or registered, when I get this uploaded, I'll go ahead and send you all a link to where the video is. That way you can have it for yourself and watch it later if you want to. And then I'll leave my contact info on our YouTube channel as well if you need to contact us, and I'll put Dr. Alker's contact info on there as well, and I'm sure he'll give it to you also when he's going over the presentation. But I just want to say thank you for showing up again to our part 2 of creating wealth with a veterinary practice. And from there, I'm going to let Dr. Richard Alker take it away.
Thanks, Jake. Appreciate it. Welcome,
yes,
everybody. Glad you guys are here tonight. This is something I'm pretty excited about and pretty passionate about in making veterinarians aware of what practice ownership can do for them from a wealth standpoint. So just to digress just a minute and a little bit about myself. I practiced private practice in Panama City for 23 to 24 years. Sold that practice in 2009, moved to Ocala, and I've been in the practice brokerage business for the last 17 years. So we been with other companies, but own a company called Synergy Transitions now, and we list and sell. We do valuations. We do exit strategy consulting, and we do buyer representation. So we're here to assist you, whether you're a buyer or seller, in your practice buying or selling needs. So that's enough about me. So tonight, as the first series we did, we talked a little bit about kind of path to ownership. Most of that was pretty basic. Tonight, we're going to talk a little bit about how practice ownership can create really generational wealth. And I don't know where you draw the line, whether it's generational or not, but to me, if you end up with enough money that you can live the rest of your life on, and you can leave some to your kids and your grandkids, then to me, that's generational wealth. Where you draw the line on how much that is, I don't know, but we're going to show you how you can what you can end up with a practitioner. So I'm gonna try to go through this. I tend to talk too fast sometimes, so I'm gonna try to slow down and kind of make sure that you understand this, because you really can't. You can ask questions, you can shoot questions up. We'll be glad to try to get them answered, or stop and take a break and answer them through the process. But I want to make sure that you understand what we're getting into here. So this slide we used on our last presentation as well, and it just kind of represents what the difference between associate employment and practice ownership are in specific areas, like autonomy of patient treatment. If you're an associate, then yes, maybe you have that. As an owner, you definitely will. Control of the drugs and products that you use in the practice. I'm not sure as an associate that that's always going to happen. Control your work schedule. Probably as an associate, that's not always going to happen. As an owner, yeah, you can close up, take off, get a relief veterinarian whenever you want to. So you'll see the rest of those. We went over that on our last deal we did on the path to ownership, but just want to kind of make a start off with kind of laying the groundwork. But there's a little bit of a difference between an associate and an owner. And being an owner sure gives you a good bit more flexibility in some of these areas. So we're going to look at the opportunity for creating wealth as a practice owner, and we're going to go through, whoops, skip the slide. All right. So what we're going to do is we're going to use the acquisition of $1 million gross in practice. We got to practice. So this is a scenario. It is theoretic, but it can be real life. And if you're disciplined and you follow this process, then the end result will be pretty good for you. So we're going to assume a $1 million gross in practice. We're going to assume that you can buy that practice for $850,000, which is pretty realistic. The typical veterinary compensation on that is going to be at 21%. So you're going to, if it's a sole practice, you're going to take home about $210,000 a year. If it's a practice that has a modest 15% profit margin, then you're going to have another $150,000 a year that you can access. So the total take home to take out of the practice pre-tax is about $360,000. So let's say you're going to reinvest into the practice each year, $60,000 of that. So you keep that aside, buy new equipment, make sure things are up to date, and make sure the facility it has the things that it needs. So your total veterinary take home is $300,000. Now there's two things we're not going to consider in here. We're not going to consider tax, and we're not going to consider the growth of investments and how much interest it's going to bear and all that. So those two things we're not really going to consider. When you get down to the brass tacks, you're going to have to consider those things. But so let's say the total veterinary take home is $300,000 a year. Let's assume that you're a disciplined investor. So keyword disciplined. If you're not disciplined, this process is not going to work very well for you. But let's assume you're disciplined. You put away 15% of what you take home in some kind of an investment, savings, retirement account, whatever you and your investment person thinks is good for you. So you're going to be putting away about $45,000 a year that way. So after 10 years, you're going to end up with an investment account of about $450,000. That does not, and by the way, if you putting this 15% in some kind of an IRA that your investment consultant would advise for you, then that does save you some tax because you're not going to pay tax on that money at that time. You'll pay it when you take it out. So you're going to accumulate $450,000 at the end of about 10 years. That's not so that's not going to make you extremely wealthy. But when you buy that practice, your debt service is going to be about $110,000 a year on a 10-year loan. All right. So the key is that after 10 years of paying debt on the practice, now you're debt free. So now you have $110,000 per year to apply towards retirement. So this is where the discipline part really comes in. Most people would say, well, golly, I just got a $110,000 raise. I can go buy a boat. I can go buy a sports car. I can, we can go travel to Italy or wherever you want to go. So that's fine. You can take some of that money and go do that kind of stuff. But if you're disciplined and you want to retire wealthy, then what we're going to propose is that you go ahead and start adding that $110,000 to the money that you're already saving. So we're going to assume that at that 10-year point, you've got an extra $110,000. We're going to assume that you're still fine working another 10 years. So that's not too much to expect. Most people put in a 20-year career before they retire. So you're going to work another 10 years, and you're still fine living off the $255,000 you were living off of before. And another thing we're not really taking into consideration right now is the growth of the practice. Hopefully your practice continue to grow, and there's certainly resources out there to help with that. But if you apply the new $110,000 per year to the savings plan you've been following, and you do that for another 10 years, so now you're putting away $155,000 a year in savings. Some of that you can do in an IRA tax, free. Some of it you can't. There's various. I'm not here to be a financial planner, but there's various IRAs and retirement plans for highly compensated individuals that you can put away a lot of money. You just have to consult the right person to be able to figure out what's best for you. So now at the end of 20 years, you're going to have a retirement account with about $2 million in it. That does not include any growth of that investment. It does include whatever interest or dividends that you may be getting during that time. And I'm not going to run a calculator and try to figure out what that may be, because that's going to vary depending on your personal risk level in investment. Some of you may be willing to put it in a 2% CD and leave it there, and at that point you're not going to gain a lot. And some of you may be a little more risk averse and buy some stocks and mutual funds and bond funds and things like that, and maybe maybe you can make 5 or 6% on that money. So we're going to leave that for what your personal level of risk is. So now you got $2 million in savings or investments. So we're going to skip and jump to the next slide. So now you've got a practice you've run for 20 years. Let's hope it's grown some. We're going to assume that it has. And now what are you going to do with it? Maybe you want to work a little longer. Maybe you're ready to go ahead and sell it and find something else to do. So at the end of that 20 years, we're going to assume that practice revenue's grown to, say, 1.75 million. That's not out of the question. And we can resell that practice for 1.5 million. Post tax sale tax is 300,000. So you're going to net $1.2 million. So now you got $1.2 million to the 2 million that you had. You end up retiring with about 3.2 million in cash and investments, not including growth over that 20 years of those investments. So that's, I just, that's, maybe to you that's not a lot of money. To me, that's enough to be comfortable for a while. And you might want to work 30. I mean, we deal with veterinarians all the time that have been working for 40 years and continuing to grow this money, continuing to put money away, and have the ability to even retire at a level of wealth that's even above this. So this could be a very conservative factor. This also doesn't really take into account any real estate that you might have owned during that time. If that practice in a lease space, obviously that's not going to be of a benefit to you. But in what we typically see is that owners that buy practices with real estate involved, then that you've got the opportunity for that real estate to appreciate. Typically, you're going to finance that real estate for 20 years. So at the end of 20 years, if you work that long, that real estate should be paid off. And let's just assume you paid $600,000 or $700,000 for a 3,000 square foot building to operate your practice in. And typically that real estate is going to appreciate probably over a 20-year period of time in a decent market, in a good location. That real estate is probably going to be worth $1 million, $1.1 million, maybe $1.2 million. And if you're debt free on it, you sell it with the practice, and that adds another $1 million after you pay tax to that nest egg that you've got. And that's really, we didn't really take that into consideration because not all practices are in, or some are in lease spaces. So not all owners own the real estate that they're in, but if you do, it's a very good wealth building tool. And we do recommend that when you have the ability, have the availability to buy a practice that has real estate, to make sure that you buy the real estate with it. So, so the point being, this all winds down to the fact: is this better than being an associate? And I'm not, you know, don't get me wrong. There's a lot of there's folks out there that don't want to own a practice, and I'm not trying to put you in, if you're in that category. I'm not trying to say that you should change your mind. You should go do this. But for those folks that are on the fence, that see that maybe I'd like to be an owner, or you know, I'm thinking about it, or yeah, it'd be nice to be an owner, to have some of the benefits that ownership can bring to you besides the wealth end of it, then I think this is something that might push you over the edge to say, yes, I definitely want to pursue practice ownership. So if you're an associate in a practice at the same time frame in 20 years, if that's all you did was work for a salary, which is fine if that's what you want to do, then you're probably going to be lucky if you end up with a investment IRA, 401k, whatever whoever you're working for might offer. You'll be lucky to end up with $400,000 to $500,000 in retirement savings over your career. So keep that in mind. That's certainly a choice, and that certainly is something that that if you don't want to be an owner, that is certainly available to you if you're working for a practice that provides some form of IRA. If you are an associate and you're working for a practice, I'd be sure that one of their benefits is that you can have some kind of retirement plan that they're going to help contribute to. So I guess that we end up with the question is, you know, for you is, where can you get a position as an associate in a veterinary practice that can create this kind of wealth and retirement security for you and your family? And I think, you know, obviously, I don't believe that associate position, I mean, that the associate position in veterinary practice is going anywhere. I don't think Jake has got to worry about the fact they're not going to have, you know, people coming out of school to put in positions as far as associates in practice. So it's not going to hurt the recruiting business. But I think for those percentage of people that want to be an owner, I think this should reinforce the fact that there's a path to do that, and that if you're disciplined and you take the right advice and you get help from the resources. The last session we talked about some of the resources for independent practice owners out there. And if you go pull that video back up, that's on their YouTube channel, and you can, if you didn't see our first session, then you can see where you can go for those resources for independent practice owners to help with practice management decisions and things like that. So we're certainly open to entertaining any questions. I can't see on the screen if anybody's putting them, but if anybody wants to throw up a topic that they might have a question about, there's something you might not have understood, or a question about how practice ownership, whether benefits or anything related to that, we're happy. It took a little less time to go through that than I probably thought it might. So we do have some time for anybody that's got any questions.
I don't see any questions yet, but we'll give them a few minutes. So I did have a question. I guess maybe it would be a question. I don't know. But would you say, as far as when you are practicing medicine as just a veterinarian, not a practice owner, using that time as well to not only get better at the medicine part, but if you do if you have that plan to own your own practice one day, using that time as well to, like you said, get with the right individuals, and learn how to open up your own practice, run your own practice. What are the best practices within that to have a successful one and to keep it growing and creating wealth?
Yeah, and that's a good point, Jake. I don't think that veterinarians should come straight out of vet school and go buy a practice. As a matter of fact,
Right.
most lenders are going to require that you be out at least 2 years. That's usually a typical threshold. And I'd say that the majority of our newer graduates that are seeking ownership are probably been out 5 to 7 years. So that's a level enough of a time to go out, get some mentorship, work for a veterinarian that encourages you to grow and grow as a leader, grow as an owner, as a well, if you're an associate, you're going to grow as an owner, but grow as a leader, take on responsibility, learn the business side of the practice, and then um, and then branch out on your own. And a lot of, hopefully there's enough veterinarians out there that are practice owners would want you as an associate to be able to go out there and own your own practice one day and let them be the mentor. And that's a great one of the resources that's out there for that next step. So
Understood.
yeah, so that's a great question. I did see a question pop up, but it
Yep.
went away about
Uh,
loans.
yep. She asks, is it feasible to proceed with the loan to purchase a practice when you already are 5K in debt, the $500,000 in debt?
Good question. So there's a group of veterinary specific lenders that lend based on cash flow of the practice. So in most cases, student loan debt does not prohibit you from qualifying for a loan for a practice. Now, if you've got student loan debt, you've gone and bought a big old house, and you got a Lamborghini in the driveway, and you got a boat parked at the dock out behind the house, then those kind of things start possibly disqualifying you from that. But strictly the fact that you have a student loan is not going to um, uh, uh, disqualify you in most cases from buying a good cash flow in practice. So typically about 60% of the lender's decision on whether that practice is a good fit for you is on the cash flow and finances of the practice. And about 40% of that decision is based on your personal financial situation, how much debt you have. And a lot of it's based on how much you're used to producing at the practice that you're at, and what your level of production is, and whether that's a good fit for the practice that you're looking at. So the lenders are out there lending money like crazy right now. So it's student loan debt's not typically a deterrent. So hopefully that answered that for you.
Yes, said thank you.
Yeah. Anybody else have any questions we can answer? Certainly be glad to do it. And hang on a second. I've got my contact information is up there now. So anybody that has any further questions, I recognize some of the names are on here. I've had you reach out to us in the past, and certainly thankful for that. But anybody that doesn't have my contact info, be glad for you to call me or email me with any other questions. We'll be glad to jump on a call. We're very committed to to having younger veterinarians and graduates coming out of vet school to understand that they have a path to ownership, and that it is feasible for them, and that there's help out there for them to do it if that's their goal. And a lot of them just don't know what that process looks like, and we're here to help them understand that process better. So don't see any other questions. Jake, anything else that I can help add to the?
I don't think so. Maybe just I guess one just popped into my head. What I guess what kind of key qualities if I'm a veterinarian looking, I'm working inside of a private practice or even a corporate practice, and I have this plan or this idea to open up my own practice one day. Where should I go first to start looking for help or advice? Who should I talk to? What kind of resources should I use?
Well, that's a great question, and we talked a little bit about that on the path to ownership. But I think to distinguish the difference between you said start my own practice, or so there's two different options. You can start your own practice, or you can buy an existing practice.
Yeah.
Yeah. So starting a practice is not as highly recommended these days as buying existing cash flow. But I take your question is to get into to practice ownership one way or another. I think there's it's always good to have a veterinarian that's a mentor to you, that you can get some advice from, that's been doing, that is a practice owner. But I think that reaching out to someone like myself, that's a broker, that's I've been a veterinarian, I've owned my own practice. We are trying to sell them, but we're trying to make sure that what we put together is a good fit, that we're helping you find a practice that's a good fit for you. We're not just out here selling practices just to get deals done. We're out to try to help make sure that it's a good fit for the seller and it's a good fit for the buyer. And that's an important part of the process. So talking to a broker that's got that knows what the market's looking like and knows what's out there is one. You're going to need a CPA on your team. You're going to need a financial planner on your team, and you're going to eventually need an attorney to talk to when it starts getting time to set up your entities and discuss the legal side of things. So those are all part of folks that that you'll need on your team. We did talk about that on the previous session, that you can go back and pull up out of that video. But that's a great point, Jay. I saw that Dr. had a question.
Yeah, Doctor, can you send that over again? It looks like it blocked whatever you had sent over out. If you don't mind sending that over again, I don't know why. I've never seen that before. Yeah, it's still blocking it.
Consider something about if you're not young anymore. Like if you're not, yeah, we do sell veterinary practices to other than very young veterinarians. So we do. I guess the things to consider is how much time do you want to still work? Okay, you're going to do a loan for 10 years on the practice. You're going to do a loan for 20 years on the real estate. Do you have enough time to pay that? I mean, yeah, you could own a practice for 5 years. I sold a practice to a gentleman earlier this year that was 73 years old. So, I guess, he'd owned a practice before. He sold it. He got bored. He wanted to get back into working, so he bought another practice. So I guess it's never too late. But I think the key consideration is the length of time that you're gonna get into debt if you're not paying cash for it. And I think that's a consideration. If you got enough time to pay, if you're 50 and you want to go buy a practice, you've probably got time to get the practice paid off, almost all of the real estate, so that when you sell it, you're going to pay off the rest of the real estate, and you're going to end up, with enough money to take care of yourself for a while. So, so I think it just depends on how long you want to work. So, does that answer that question for you, Doc?
Looks like it looked like there was okay.
Said yes. So good.
Yep.
All right.
Awesome.
Anybody else we can help answer any questions for?
No, it looks like we're all good. I don't see anybody else
Okay.
typing.
All right, guys. Well, I sure appreciate you being here tonight. I know you could be doing a lot of other things. I'm getting ready to go watch the Stanley Cup for first game of the Stanley Cup um, playoffs. So I'm getting ready to go jump run the TV. But I appreciate y'all being here tonight. Lots of other things you could be doing, and certainly reach out to me if we can be of any benefit. And for those of you that are looking for jobs or end up practice owners, obviously Jake and his team can certainly find veterinarians for you or find places for you to work. So they appreciate you being here too. So
Yeah,
all
thank you
right.
guys. I appreciate you showing up. Thank you for registering. Like I said, I'll go ahead and send a follow-up email to you all as soon as I have the video edited and ready to go. And we'll look forward to seeing you again. I'm sure we'll do plenty of more presentations for you all in the future. But I thank you all for showing up to part 2 of the series. And again, if you didn't see the first one, that is up on our YouTube channel right now. If you want to go ahead and view it there. But thank you guys. Appreciate your time and hope to see you on the next one.
All right. Thank you guys. Yep. Y'all have a good evening.